My name is Alexis, and I will be informing you on the breakthroughs in cancer research. Cancer has been around for many years, but a cure has yet to be discovered, and more than 11 million people in the United States have some form of cancer. There are over 200 different types, and many are rare. Some of the types include skin cancers, lung cancers, liver cancers, malignant tumors, benign tumors, brain tumors, and much more. The National Foundation for Cancer Research uses grant money and raised money to develop 19 novel research tools and technologies which are critical for screening, delivery, manufacturing, and continued clinical research, 7 biomarkers which are used to develop new tools for early detection and personalized treatment options, and 19 new drug ideas and potential therapeutics. On MSNBC.com, it states that cancer is the leading cause of deaths in Hispanics, and now they're doing a study with pregnant women in cancer. In 1994, 112 people out of every 100,000 pregnant or postpartum women received a cancer diagnosis, which is much less than the 192 per 100,000 women in 2007. Researchers say this may be a result of the better equipment procedures for cancer combined with the older average age of expectant moms, because cancer is known to increase with age. In 1994, 13% of pregnant women were over the age of 35, and in 2007, 24% were over the age of 35. The most common cancer in pregnant women is melanoma, which is an intense skin cancer, and Australia has the highest risk for melanoma because they're close to the equator and receive a lot of sun. Fortunately, babies don't seem to be harmed and have no birth defects as a result of their moms having cancer. For medicalnewstoday.com says that oral cancer can be reduced by about 17% by the increased consumption of green vegetables such as cabbage, cauliflower, sprouts, and broccoli. And eating more green vegetables doesn't just reduce the risk in oral cancer, but also in kidney cancer. It reduces the risk by 32%, esophageal cancer 28%, and colorectal or breast cancer 17%. Dr. Nigel suggests that omega-3 found in fish and eggs combined with a fiber diet found in brown rice and pasta can reduce the risk as well. Other ways to reduce risk of any cancer is the increased use of vitamin D, which slashes the risk by 77%, and using the mineral selenium, which vitamin D is found in fish, milk, soy milk, and cereals with wheat and whole grain. Researchers behind ScienceDaily.com discovered 13 proteins essential for detection of malignant mesothelioma, which is a rare, aggressive lung cancer due to prolonged exposure to asbestos. Before this breakthrough, there was poor, proper, and inaccurate diagnosis as a result of it being too difficult to get it. And this breakthrough appeared when the blood of an exposed person without the disease was compared with a person with the disease, and the 13 proteins were linked to the disease. There's a new memory thought process for managing breast cancer symptoms. Diane M. Bond and 2 colleagues developed and tested different treatment possibilities for survivors with frequent suffrage with memory and mental slowness and depression, which leads to anxiety and fatigue and overall poor quality of life after treatment is complete. This program is called Insight, and it's performed for memory and to increase the ability and speed of process information. It's a computer program, and participants go through information tasks that get more difficult as the tasks go on. Leaders teach tips and strategies for remembering word lists, sequences, and informations. And it was able to be developed by the grant money received and may be open soon in months. To conclude, there's a quote that I found, and it says, "Cancer is not a disease, it's a survival mechanism." And I believe that's true because a lot of people with cancer aren't like just living with it, they're surviving with it with every minute of every day.